Hand pain. The hand is an intricate body part comprised of heap bones, tendons, ligaments, nerves, skin, and different constructions that permit its anything but a wide assortment of exercises from fragile control to truly difficult work. All the intricacy and requests can prompt a variety of conditions that can make your hands hurt. What causes hand pain? While it can have numerous causes, only a couple conditions are answerable for most hand torment. Some require clinical treatment, while you might have the option to diminish others all alone with self-care. The most widely recognized reasons for hand torment include arthritis, tendinitis, trigger finger, ligament injury, carpal tunnel syndrome, injuries, ganglion cysts, Raynaud's phenomenon, scleroderma, arthritis. The hand is the most well-known piece of the body to foster joint pain and particularly osteoarthritis, which is an ordinary piece of the maturing cycle and includes the deficiency of ligament in your joints. By far most of individuals beyond 60 years old have indications of osteoarthritis in their hands. However, some people develop hand arthritis at an earlier age. Manifestations, which at times can be serious, include joint pain and inflammation, joint stiffness, limited range of motion, cracking, grinding, or popping in the joints. Eventually, misaligned joints and possibly deformity. Osteoarthritis is the most well-known kind of joint infection influencing the hand. Different sorts can include the hand, also, including rheumatoid joint inflammation, RA. RA is an immune system sickness where your insusceptible framework assaults the covering of the joints. Tendinitis, trigger finger. Tendinitis includes aggravation inside or around a ligament. That influences the manner in which your hands and fingers move and causes torment and expanding at the site of the aggravation. Tendinitis is brought about by wounds, normally a sharp, unexpected development, or dreary developments. Some of the time, ligaments foster hard irregularities considered knobs that you can feel through your skin. They can get on different designs in the hand and make your finger stick as you attempt to move it. When the ligament discharges, it's anything but a snapping sensation known as a trigger finger. The reason for knobs isn't completely seen, yet they can be identified with ailments like RA and diabetes or certain powerful developments of the fingers. Ligament injury. Your hand has 27 bones that are totally associated by an intricate organization of ligaments that take into consideration development while balancing out your joints. Any sort of injury to your hands can harm at least one tendons, which causes issues with basic exercises like twisting your fingers, grasping, or squeezing. Tendon wounds in the hand can require a long time to mend, and it's anything but phenomenal for individuals to see expanding and firmness for quite a while afterward. Carpal tunnel syndrome. A few significant nerves give sensation to the hand, and when one of them is harmed or compacted, for example, by irritation, it's anything but a great deal of torment and decrease work. The most widely recognized hand condition including nerve pressure is carpal passage disorder, which happens with bothering or harm to the middle nerve in the wrist. Carpal passage disorder causes hand torment that can be pain-filled and here and there, zingy, just as shivering or deadness in the fingers and thumb. Scouring within your wrist may cause shivering or electrical nerve sensations, as well. Agony can likewise transmit up your arm, and you may see shortcoming or awkwardness. This condition is frequently brought about by monotonous pressure, like broad composing, checking goods, or utilizing a mallet. Heredity is additionally accepted to contribute, as are different conditions including RA, diabetes, and thyroid infection. Different nerves providing the hand can likewise get squeezed, prompting manifestations in various regions. At the point when it's the ulnar nerve that runs behind your elbow joint, it's called cubital passage condition. Injuries. The hand is defenseless against numerous sorts of wounds, including bone cracks and muscle strains. Possible reasons for hand wounds are unlimited. Fingers get stuck into things. Hands get pummeled in entryways, and during certain games, your hand may even get stepped on. With bunch little bones, joints, and muscles in a little space. You can have a wide range of breaks or strains that each accompany their own particular side effects and useful constraints. It's imperative to have a specialist assess and treat genuine wounds so they can mend appropriately. Ganglion cysts. All through your body, you have joints and ligament sheaths that typically contain liquid. A ganglion pimple happens when that liquid amasses into a pocket, which appears as a knock. These sores foster regularly in the wrist. Ganglion sores cause torment when they meddle with ordinary developments of the joints and ligaments. They're regular in the hands for two reasons. 1. Hands have a large number of joints and ligament sheaths where the sores can frame. 2. They're not difficult to see on the hands, though somewhere else they may go undetected. The reason for ganglion sores is obscure, yet they're more normal in ladies and grown-ups under 40. Individuals whose wrists take a ton of strain, like gymnasts, are particularly inclined to. The cause of ganglion cysts is unknown, but they're more common in women and adults under 40. People whose wrists take a lot of strain, such as gymnasts, are especially prone, as well. Numerous other more uncommon reasons for hand torment exist and ought to be thought of if a more normal issue isn't recognized. Your PCP can help decide the specific condition that is causing your manifestations and track down the most fitting treatment. Raynaud's phenomenon. In Raynaud's phenomenon, also called Raynaud's syndrome, your fingers and possibly other extremities have an abnormally strong reaction to cold temperatures. They may turn blue or white when chilled and then get bright red when they warm up. Some people experience a painful throbbing, tingling, or swelling. Other parts that may be affected by Raynaud's include ears, nose, nipples, knees, toes. Raynaud's is brought about by over-responsive veins in your furthest points. At times, it's a side effect of another condition, like immune system or connective tissue illness, hypothyroidism, or fibromyalgia. In different cases, it's obscure what causes the veins to act unusually. Scleroderma. Scleroderma is an infection that makes the skin and different organs solidify. It particularly influences the hands and face, and one of the principal side effects is frequently swollen, agonizing muscles and joints in the hands. The sickness might be restricted to specific pieces of the body or be inescapable. Scleroderma includes irregularities of the insusceptible framework, connective tissues, and little veins. However, the fundamental reason for those anomalies isn't yet perceived. When to see a doctor? Most often, hand pain will resolve with some simple treatments. However, some conditions require more urgent treatment. You should call the doctor if you have signs of infection including redness, fevers, and chills, deformity of the hand or fingers after an injury, inability to bend the fingers or make a fist, worsening numbness in the fingers or hand, pain that does not improve with simple treatments. Diagnosis. Specialists have a few instruments for sorting out the reason for your hand torment. More often than not, they'll inspect you and afterward choose what tests are important for making a conclusion. In the event that your PCP needs a glance at the designs inside your hand, they may arrange X-rays, ultrasound, computed tomography, CT, scan, magnetic resonance imaging, MRI. Treatment. Most hand conditions respond to a few simple treatments. Even broken bones in your hand may heal with simple, non-surgical treatment. However, you should get checked out by a doctor to make sure nothing's going on that requires medical care such as physical therapy or surgery. Your doctor can also tell you whether immobilization, such as a splint, is necessary. Self-care. At the point when you have hand torment that is not a crisis, You might need to attempt some basic measures to help control your agony and improve work, including rest. Hand pain from a minor injury, overuse, or repetitive stress often resolves with rest, which allows inflammation to subside. Ice. Ice can reduce inflammation and pain from many causes. Heat. Stiff joints and achy muscles may be soothed and loosened up by heat. If your hand pain is the result of a systemic condition, such as RA or scleroderma, treating the underlying disease is likely to help, as well. Surgery. Some hand conditions may improve with surgery, including severe breaks, torn muscles or connective tissues, carpal tunnel syndrome. Severe cases of arthritis in the hand may require joint replacement surgery. Thank you for watching.